Hi, I'm Ken Cutbush. I'm an orthopaedic shoulder surgeon working in Brisbane. I'm going to talk to you about the risks and potential complications of arthroscopic stabilisation surgery. So this is an example here. This is an MRI scan of a patient of mine. This is a cross-section. This is the back of the shoulder. This is the front. Here at the back of the shoulder, you see a little Hill-Sachs lesion. And this white here, blush in the bone, that's bone bruising. What's happened is the shoulders come out the front here and then hit back against this corner, forming what we call a Hill-Sachs lesion in the back of the humeral head. And at the same time, as it's come out, it's caused a labral tearing. You see, this is labrum at the back of the shoulder. That's entirely normal. It should be mirrored to the front, and we're not. We're seeing a little tear down through here at the front of the shoulder. And this is fixing that patient. You can see I've put two anchors at the bottom here. This is inferior coming up. This is the third one here. This little passer with the passing wire, you see a little wire in there, and then the completed repair at the front from posterior and then from superior looking down. This is inferior, anterior, posterior, and this is inferior, superior here looking from the back to the front. So that's what we're talking about. And those, when we talk about anterior or global, the anchors need to be put where we need to put them at the back, or inferior or anterior, where we need to get stability of the shoulder. When I'm talking to patients about an arthroscopic stabilisation, what I explain is it's arthroscopic shoulder surgery. It's not particularly risky. The risk of infection is 1 in several hundred. The risk of nerve injury, 1 in a few thousand. When we ever operate on a shoulder, there's a risk of frozen shoulder. Frozen shoulder will go away and resolve of its own accord and will actually help the repair heal up. However, it can be miserable until it goes away, and you do need to be aware of that. There is a risk of redislocation. No matter how we fix the shoulder, for instability, there's always a small risk of instability. For a arthroscopic shoulder stabilisation, I would normally quote around 5% risk of redislocation at a later date, normally related to a further injury. And you have an anaesthetic, so there's a risk from the anaesthetic. Let's put some science behind this. There are two papers I'd like to look at. One is Rodriguez et al. In Journal of Shoulder and Elbow Surgery in 2024, and the other is Williams et al. In American Journal of Sports Medicine 2019. Let's take the Williams paper first, 2019. They looked at 56 papers, scientific papers, discussing the risks of this shoulder surgery. That's 4,336 patients, or 4,362 operations. So their complication rate was 1.6%, quite low. As I said, this is not particularly risky surgery. Recurrent instability, 16.4%. I think that's fairly high, but it depends on how long that's been done over time periods been looked at. Symptomatic hardware, 0.1%. One of the things that can happen is you get little squeaks related to these suture material. The suture material is quite robust suture material, and that can happen in the first few months. It normally goes away. If it doesn't, 12 months later, I will go in and pull those sutures out. But that's quite rare, but it does happen. Knots, this is a knotless anchor design. Some of the anchors have knots, and those knots can cause problems. Or they can come loose, the suture can come out and then catch within the joint. All of these things are rare, but can happen. Postoperative stiffness, normally we're talking about frozen shoulder, but you can also get some scar tissue around the shoulder, and that does exist. Williams et al. Quoted at 0.7%. Rodriguez et al. 0.32%. Temporary nerve injury, 0.2%. So they didn't have any permanent nerve injuries. Infection, 0.3%. So as I said, 1 in several hundred. Persistent pain, it's rare, but some people will get persistent pain, so it runs at 0.1% or 1 in 1,000. And bicipital tendonitis can occur as well. The long-headed bicep tendon can be irritated. If you look at Rodriguez et al. 2024, 14,000 patients. So there's 194 studies, 0.67% complication rate. They didn't give us a rate of recurrent instability. We did get a rate of symptomatic heart rate, 0.05%. That's extremely low. Postoperative stiffness, again, it does happen, 0.32%. Temporary nerve injury, 0.07%, so extremely rare and was temporary. Infection, 0.03%. Persistent pain, 0.17%. So that's a pretty good overall, pretty good discussion of the potential risks. If you'd like to look at these papers themselves, you can scan that QR code. The QR code will take you directly to that publication. You can read it yourself and check it out for your own information. Thank you for looking. That's a good summary of the risks and potential complications of arthroscopic stabilisation surgery.